Hello, it's me, it's Darren. Yes, I'm back. An update at last. Sorry about the delay. The last time I updated apparently was 2020 when I was talking about KTP. I had a KTP, that's, what's KTP? Potassium titanyl phosphate, that's what KTP means. K is representative of potassium on the periodic table. Anyway, it's a vascular laser. I tried that. This was during lockdown when a lot of the clinics had shut down and pulse-dye laser wasn't available. I'd been having pulse-dye laser, also known as Vbeam, in Nottingham, but that clinic shut down and they got rid of the pulse-dye laser machine. It was the Vbeam Perfecta, so I wasn't able to have any more treatments. I think I said in one of my previous videos, the last treatment I had with Vbeam actually made it worse. So during lockdown, I was going to a lot of different clinics. I went to this clinic in Nottingham offering KTP. It was the Cutera Excel V, which has pulse or continuous laser. Tried that, didn't work, pointless. I went to some other clinics. I went to a clinic in Loughborough. I had 7 IPL treatments, that's the Lynton IPL, and that didn't do anything. Not that the person administering the treatment was necessarily doing it badly, it just wasn't working. And I went to another clinic in Nottingham, also for IPL, that was with a skin-based IPL, also did nothing. So I was running out of options and I decided to give it a rest. And then I got a job working remotely for a software company, and I was always struggling with my skin, having to be on camera, and I used Azelaic acid and things to try and disguise the redness, and I started using mandelic acid at one point to try and exfoliate the skin, to try and get the skin cell turnover going. As you get older, your skin cell turnover slows down, so sometimes the redness can be, alleviated if you exfoliate, but it can aggravate rosations, and that's exactly what I did with mandelic acid. It's the 10% one by The Ordinary. I've got it here actually. That's not it, that's alpha-arbutin. Here we go. Mandelic acid. So you only use this once every 2 weeks or once a week if you're feeling brave. Anyway, I eventually found another clinic that does pulse-dye laser, and guess what? It was the Vbeam Prima. That's the successor to the Vbeam Perfecta. It actually has a wider spot size, so I think 10mm was the Vbeam Perfecta's spot size. This one was 15, so you can hit a larger area of skin. It has a better cooling system as well, and it leaves less bruising. So I went to the Everything Skin Clinic in Manchester. No, this is not an ad. I'm just saying I went there. That's all I'm saying. It's in Cheadlehume Village. And guess what? The dermatologist, who, he's the leader of the clinic, he is the president of the British Medical Laser Association. So I had an initial consultation with him. How much was that? It's about 250 quid. Only in there for 5 minutes. God, that hurt more than the laser that I would eventually go on to have. Yeah, so I had 5 rounds of treatment with the Vbeam Prima. So by the time his name's Dr. Madan, Vishal Madan. By the time I got taught, I've been through this so many times, I could have a very high-level technical conversation with him. I wasn't a tourist. I've been down this road many times with different clinics, so at this point I just wanted to have a very straightforward, no-nonsense conversation. He answered my questions. I threw him a lot of curveballs, asking him questions about pulse width and pulse duration and that sort of thing. We started off very slowly on a low setting. I explained the whole reason that I was having these problems. I was a blusher, a flusher. I'd had it since around 2009 following a severe episode of stress. I think my gut lining, my stomach became compromised. Stress can do that to you, it really can. eating the wrong things, food permeating the gut wall lining, affecting my bloodstream, anxiety, blushing, flushing, headaches, all that stuff. And then, of course, if you've watched my previous videos, you know about the Mevaso. It's a medication manufactured by Galderma. Don't know why that shit is even on the market. Look at the comments on some of my videos. People who have been prescribed Mevaso experience the severe rebound flushing that I experience, leading, in my view, to what I would call acute angiogenesis, where you get like a sudden growth of blood vessels in the face. So I was having severe blushing and flushing rebound from Mevaso. I used it twice in 2017, and for the next several years my face was flushing aggressively and consistently, and it was very painful. It even affected my ears. My ears became permanently bloodshot, my face was permanently bloodshot, and I would flush and blush at the drop of a hat. Gust of wind, blushing and flushing. Loud noise, blushing and flushing. Hot cup of tea, blushing and flushing. Bend down to tie my shoelaces while you get the picture. I mean, exercise was kind of off the table at this point. I do go walking a lot to try and get my exercise in. So 5 rounds of Vbeam, aka Pore Style Laser, with Dr. Madan at the Everything Skin Clinic. Each one was spaced roughly a month apart. Started off slow, built up to the high effluence. I didn't see any improvement until the final one, the 5th one. I think that might have helped. I said to him, look, I've been down this road many times. I know you want to be careful with the fluence. You don't want me to get the, after what happened with my November 2019 Vbeam in Nottingham, making everything worse. He was keen not to repeat that. I said, look, you've got to go a bit higher with the fluence. And he said, well, to be honest with you, out of all the patients in this clinic, you are the one with the highest settings. I said, all right. So he nudged up the fluence a little bit more, I think. Not a lot, just a little bit. And I said, right, this has got to be the last one for a while. That was in January 2024, it's now October. And I've decided to give my skin a rest for a little bit. And all I've been doing this year is avoiding the sun. We've had some hot days, but I've been avoiding going out in the sun. When I do go out in the sun, sunscreen, of course. So what are the results of this Vbeam? Has it made a difference? Do I recommend it? Well, if you can afford it, do it. It's expensive, but I think it's probably worth having a couple of Vbeams rather than endless IPL. IPL usually doesn't have a very good cooling system, whereas Vbeam does. It stings momentarily, but it's quickly cooled down. It's like someone stabbing your face with hot cigarettes, but the cooling sensation is immediate, and after you've done, it stings for the next hour or two. It will be smarting, but compared to IPL, that was bloody torture. That was. I think it's helped a bit. I'm not that impressed with it. I'll be going back, of course. If I'm going to be having Vbeam, I might as well be having it with him. There's nowhere in Nottingham that I can find that does it, and some of the clinics refuse to treat me because they didn't think there was a problem. I had to explain that I'm really a blusher and a flusher, not necessarily a baseliner. So I will be going back for another one, maybe in January. I always do it in winter time because there's less chance of having complications with sun exposure. I don't seem to flush and blush as much anymore, but I'm doing other stuff as well. I exfoliate. I alluded to my mandelic acid, so I do use this about once a week. I use it on the forehead and on the nose mostly, just a few drops. I dab it on. I'm avoiding the cheeks for a little while. I might start to build it back up again. But what I have been doing is using also lactic acid. So this is another alpha hydroxy acid, the same as mandelic. This is a 5% lactic. I'm going very weak on the lactic. In the past, God, you know, so following this Vbeam in 2019, Pulse Style Laser Vbeam in 2019, I got home, I washed my face and I moisturised with a moisturiser, and about 2 hours later my face was on fire. When I looked in the mirror, it was bright red, and I think it was because there was lactic acid and witch hazel in the moisturiser that I used. It was a cheap one from it was from Aldi. I forget, it's their own brand. It begins with an L. But I didn't realise there was witch hazel in it, because that's an astringent. That's very irritating to compromised skin. And there was lactic acid in it. I mean, really, you want simple. This is a simple moisturiser. It's literally called Simple. But that had lactic acid in it, this other moisturiser, and I'm sure that set me back and it interfered with the Vbeam. Because everything, I'd never had that reaction before to Vbeam, but that was the one that really sort of fucked my face up a bit. I mean, I ended up really red permanently. So I am gingerly using lactic acid again. This is just a 5%. I use this 2 or 3 times a week. And I'll just go like this. I'll put a few drops on my forehead. You have to be careful with lactic acid or any alpha hydroxy acid if you've got rosacea or flushing or blushing. But I want to do something about the texture of the skin as well, because it's all very well having laser and IPL and all of that, but sometimes you just got to get the skin cells turning over. So, because skin cells push up from the dermis up to the top, and on the very top layer of skin, so you've got the dermis, the epidermis, and then you've got something called the stratum corneum, which is like, it's almost like a protective layer. It sits on the very top of the skin, and it's old dead skin cells that sit there, and that's good in some ways. It protects you a little bit from the sun. But you also need to slough off the stratum corneum with either exfoliants or by using mechanical exfoliation. So I'm just trying to get my skin turning over, and I've noticed when I look in the mirror, sometimes my skin seems a bit clearer. It seems like I'm getting more back to the baseline that I used to have. Don't get me wrong, I'm still a blusher and a flusher, but the baseline was a little bit compromised as well. In so much as the flushing and the blushing, I've done a lot with my diet. I've really cleaned up. I mean, I was never an unhealthy person, don't get me wrong. It wasn't like I was gobbling kebabs, burgers and pizzas and quaffing pints of beer. I mean, I don't smoke, I rarely drink alcohol, and if I do, it's like a one-off. I drink a lot of green smoothies. I've got a video about green smoothies. I drink bone broth, which I make myself. I, get beef bones from the butcher. I roast them. I cook them slow in a slow cooker. Get this like gelatin substance, which I then refrigerate, and then I'll add that to my cooking, or I'll just drink it. It's a bit like Bovril, actually. It reminds me of Bovril. You can warm it up and drink that. Good for the gut. It's collagen, so there's more collagen in bones than there is calcium, but your gut lining needs collagen. That's what bone broth is. The skin benefits from collagen. Your hair and nails benefit from collagen. Speaking of hair, skin and nails, I do take biotin every day. I think it's fat soluble. I'm not sure if it is. Try and take it with a healthy fat, like full fat Greek yogurt or coconut oil, something like that. I also take vitamin D and calcium, multivitamins. I also take vitamin B. I've got propranolol on prescription. This is 10 milligrams of propranolol. I used to be on the 90 milligram propranolol, which was like a slow release that would slowly release all day. The thing is about taking medications, it can contribute to hair loss, I think, and it's not something you want to be on. I'm not on the SSRIs anymore. I don't know if I ever told you I was taking antidepressants just because I couldn't really cope with the blushing, the flushing. and the endless quest to correct my skin, which wasn't really working. So that was depressing. So I went on antidepressants. But I came off of those because I felt that they were probably contributing to hair loss. My hair's not as thick as it once was, so I've come off them. I use niacinamide. I mix that with my moisturiser. I'm running low on this. This is the Inculist niacinamide. I don't like the ordinary niacinamide. I think it irritates me, but I use this a couple of times a week. Mix it in. This is 10%, so it's pretty strong. Mix it in with my moisturiser. So by the time I mix it in, it's probably got a strength of like 2% or something, which should be enough for niacinamide to be effective. It should even out skin tone, fine lines and wrinkles. Most people can use it, not everyone gets on with it. I use a CeraVe moisturiser in winter. This is good because it's got petrolatum in it. It's very viscous. It's also got hyaluronic acid and ceramides in it. So this is good for winter time. What else do I want to tell you? I think that's it. And I've got alpha-arbutin. I've been experimenting with that. I've also been experimenting with a strong vitamin C. The vitamin C I've been using is the one from The Ordinary. I can't remember what it's called now. I think it might be vitamin C in suspension. It's about 20 something percent, so that's pretty strong. So don't just start slapping that all over your face. If you've got redness or rosacea, try and ease into it slowly. What else? Oh, yeah, azelaic acid. Now, I've run out of azelaic acid. I've got it on repeat prescription with my local GP surgery. I've explained to them why I want it and what I want it for. I had to do a bit of convincing. It's the Finacea. It's 15% azelaic acid. It's gel. The carrier is gel. You can get a stronger one, which is 20% in a cream carrier, but studies apparently show that the gel carrier and the 15% azelaic acid are better. I use that for generalized redness and texture. It helps to stabilize my skin. I don't seem to blush and flush as much when I've got that on my face. It also has a little bit of a sort of mattifying effect, so the skin just seems to look a little bit paler. It just seems to just tone everything down. If you are using products like exfoliants and azelaic acid, I'd stop all that stuff about 2 weeks before any laser that you have, and I'd give it a good 2 to 3 weeks before you start to reintroduce that stuff again. So 2 weeks before the laser, stop all that. 2 to 3 weeks after the laser, make sure that's a good sort of buffer period. I don't know what else to tell you really. I know some people were saying that they've been trying out pulse dye laser and it's affected their skin negatively. They've got depressions and fat loss. If that's true, I'm really sorry that's happened to you. The doctors I've asked about that say that that's impossible, that it doesn't happen. But if people are reporting it, then clearly it is happening. Sometimes there's this tendency to blame patients and say that it's patient bias or they're mistaken, but I don't know. I've heard plenty of horror stories about Vbeam leaving indentations in the skin. I mean, there are times in the past where I felt that might have happened to me. You know, I'd run my fingers over my face and I'd think, I'm sure there's a depression there. But I gained a little bit of weight over the last couple of years, so my face has filled out a bit more. And if that was the case, then I don't think it's as noticeable. What I have been doing, by the way, here's a bonus tip. So let's say you are having laser and you want the best chance of recovery following your treatment. You could try using Anica. I don't know if you've heard of Anica. So, I had a tube of it here somewhere. I've just about used it all up. Oh, here it is, Anica. You can buy this in the chemist. Now, some people say it makes no difference, but there's no harm in trying because some people swear by it. A couple of weeks before you go in for your Vbeam, you could apply this every day to your face, maybe at night time. This stuff stinks, actually. Oh, yes. I wouldn't want to wear this in the daytime, not if you've got sunscreen or azelaic acid on in the daytime. I'd use this at night. Put this on for a couple of weeks before you go for your Vbeam, and then a couple of days after you've had your Vbeam, start applying it again. So you're front loading with Anica, and you're using it after the treatment for a few weeks. You also might want to try eating a lot of pineapple before and after the Vbeam treatment. If you want to know why that is, look it up online. There's something in fresh pineapple, not canned, tinned, I mean fresh, and it's to do with the core of the pineapple. But I ate loads of pineapple. I thought, if I'm going to spend 450 quid on a Vbeam treatment, which takes all of 10 minutes or maybe less than that, I want to make sure I'm getting the most bang for my buck. So I want to at least try these things, Arnica, pineapple, you know. What else can I tell you? I've got an electric fan. So when I got home, I sat in front of an electric fan and I was applying a lot of organic aloe vera to my face. I was also using Vaseline as well to keep the skin sort of protected. Vaseline can act as an occlusive as well, which can speed up healing time of the skin. So I was doing everything I could think of to increase the chances of having a successful outcome. Just stay out of the sun, don't go out in the sun, try and take some time off work. For a good 2 to 3 weeks afterwards, you'll look quite bruised. I know some dermatologists will tell you that you'll be fine after a few days, but that's not the case, not for me. And I had the Prima, which is reduced bruising, nothing like when I had the Perfecta. And even then, it was still pretty bad. So if it's your first time having Vbeam, brace yourself, because it's pretty shocking. But stay calm, keep calm and carry on, and follow some of the steps that I've given you here. Eat clean as well. If you wanted, you could do a fast. You know, fasting is known to induce something called autophagy, which is where the body stops digesting food and goes into repair mode. Autophagy is where old skin cells effectively eat themselves. There's like a cannibalization of old or damaged skin cells. So if you wanted to, you could make it a fast. You could do it something, over the weekend. It might improve healing. I don't know. I've never done it myself. I do fasts, but if I were to do another fast, I'd probably do it in the days following a Vbeam treatment, hoping that would do something to help speed up recovery time. In fact, if you do have redness and flushing, maybe you should be doing intermittent fasting. I mean, whenever I've done it, the longest I'd done was like 3 days. The only thing I had was bone broth with a little bit of salt in it. That was it. That's all I had. No solids. Just drinking bone broth with a little bit of salt to keep my electrolytes up. These are the things that you might have to do if you've got this redness problem. Some of it might be internal, but I'm trying to tell you to hit it on all fronts, the face, externally, the blood vessels, but also internally as well. So with that, I hope that's okay. I hope this is the update that answers some of your questions. If you're going through this yourself, you have my sympathy. I know people will often tell you, but you look fine to me, but they don't realise that the blushing and the flushing is episodic. It's like someone who's got Crohn's disease or IBS, it's often flare-ups that they have. They might be fine for a little while, and then their triggers cause them to have the flare-ups. So if you have my sympathy, if you're in the same position as me, it's bloody annoying when people keep telling you there's nothing wrong with you, when you know damn well there is. And if there wasn't, then why the fuck are you spending all this money on skin treatments? So take care, stay healthy, and see you on the next update.